This week, we're going to talk about community health workers and their increasingly important role as interpersonal influences on health. I think you might want to consider including them in the design of your intervention or program. And I'm also going to share with you a little bit about what I know about them as well as how I've worked with them in the past. Who are community health workers? Community health workers are highly trained, trusted community leaders who serve or have a close understanding of the community. There are many names for them, including outreach worker, promotora or promotores de salud, patient navigator, peer counselor, lay health advisor. Maybe you've heard different names. I like to think that they're characterized by servicio de corazón, service from the heart. I like this quote. The work of promotores is knocking on doors when you have no idea what you will find on the other side, knocking on doors when they are not ready to hear what you have to say, sharing information that one day will be exactly what they need to hear. What is their role? Community health workers are uniquely qualified as connectors to the community because they generally live in the communities where they work and understand the social context of community members' lives. There's many roles for community health workers, including helping individuals navigate complicated medical systems or treatment regimens. They teach individuals how to manage their chronic disease. They might be someone that teaches nutrition or physical activity classes to community members. But overall, they improve the quality and cultural competence of service delivery. Community health workers are also very valuable because they help reduce system costs for healthcare by linking patients to community resources and helping patients avoid unnecessary hospitalizations and other forms of more expensive care as they improve health outcomes for community members. There is more and more evidence supporting the integration of community health workers into multidisciplinary health teams. This has been shown to be an effective strategy for improving the control of various diseases such as hypertension and diabetes. And the idea is to pair community health workers with nurses or other healthcare providers who are working with patients. And that helps the individuals keep their appointments. It helps with treatment compliance and prescribed regimens, and also risk reduction. Community health workers are often seen as natural advocates for the dignity and rights of all people. They see their role as defending, protecting, and including the community in decision making. So, healthy communities are defined by a process that includes a high degree of public participation in and control over decisions affecting one's life, health, and well being. It also includes a clean, safe, high quality physical environment. It also includes the idea of meeting of basic needs, which includes food, water, shelter, income, safety, work for all people, and a strong, mutually supportive community. In this way, health promotion requires the empowerment of individuals and communities, enabling them to exert more control over all the factors that contribute to their health and well-being. So community health workers, many people believe, need to be at the table as active participants. In this way, they can serve as representatives for their communities. There are a lot of recommendations on how to support community health workers and give them an even more powerful role involving addressing upstream health determinants. And this includes providing promotores with sufficient time to build mutually beneficial, trusting relationships, to establish a process that encourages collaboration and cross-sector information sharing. Again, giving them more time to address these upstream issues and involving them in decision making, giving them a space at the table. And again, I said promotores, but I'm also talking about community health workers and all the other names that we use to describe this very valuable role. I've worked with community health workers in a variety of ways. Many years ago, when I was working at University of California, San Diego, I worked on a project where we taught nutrition classes to Latino parents. We also taught physical activity classes as well, and we worked with promotores. And these were women from the community of our priority population. They lived there, they knew their community strengths and needs, And they were just so able to quickly connect with the families in a very natural and easy way. And building that rapport from the very beginning meant that people kept coming to our classes, and there was a lot of trust, and we witnessed the relationships building over this 8-week period. I currently work on a project right now where we try to empower communities to become more prepared for emergencies. And in the last few years, we held a training where we worked specifically with Latino community health workers, promotores, and taught them basic emergency preparedness skills that they were able to then in turn pass on to the communities that they serve. And I also work on a project that focuses on the importance of protecting pregnant women and other vulnerable population when it comes to consuming soft cheeses that are commonly imported from Mexico. And we recently held a small workshop at a conference where we taught a lot of community health workers about the importance of eating safe pasteurized cheese. This is a group that's here locally in San Diego. It's called Poder Popular, and they are community health leaders that are connected to a group called the Farm Worker Care Coalition. So they're in the north part of San Diego in a very agricultural part of our county. And they often go through an 8-week training that's supported by the California Endowment, and they learn about prevention, health promotion, how to organize sustainable community action. They learn general community skills, leadership, advocacy, community organizing, and how to deliver presentations. And then in turn, they take these skills and they share it with the community that they serve. So just to give you an example, we had huge wildfires in 2007, and many of our farm workers and migrants in this area were disproportionately impacted and had little or no relief. And so these leaders, these community leaders, were able to organize a huge grassroots response to support these families and help get them coordinated to different resources and services to help with assistance and mainstream relief sources. So this is just another example of how powerful community health workers can be into connecting to a community and being that liaison. These are the references I used for this week's brief lecture.